The table summarizes the peripheral parasympathetic ganglia present in the head and neck region. These peripheral ganglia are OT ganglion, submandibular ganglion, pterygopalatine or sphenopalatine ganglion, and the ciliary ganglion. These peripheral ganglia receive general visceral efferent, that is visceral motor fibers, which are preganglionic parasympathetic fibers, which arise from the general visceral efferent nuclei present in the brainstem. These fibers relay in the ganglia, and the postganglionic fiber arising from the ganglia pass via different nodes and eventually supply the glands and the smooth muscles. Now coming to the otic ganglion, the otic ganglion is located in the infratemporal fossa, just below foramen ovale, medial to mandibular nerve. The preganglionic fibers arise from the inferior salivatory nucleus present in the pons. The fibers from this nucleus will travel via glossopharyngeal nerve, its tympanic branch, tympanic plexus, lesser petrosal nerve, which will eventually relay in the otic ganglion, and the postganglionic fibers come out from the otic ganglion and pass via auriculotemporal nerve to supply the parotid gland. In this diagram we can see the preganglionic fibers which are arising from the inferior salivatory nucleus pass via glossopharyngeal nerve, its tympanic branch. The tympanic nerve enters the middle ear and forms tympanic plexus. The tympanic plexus grooves the promontory present in the medial wall of middle ear. Arising from this plexus is the lesser petrosal nerve, which comes out of the middle ear via the groove and hiatus for lesser petrosal nerve. And the lesser petrosal nerve will come out of the foramen ovale, enter the infratemporal region, and these fibers will relay in the otic ganglion. The fibers which come out of the otic ganglion after synapse, they are postganglionic fiber which pass via the auriculotemporal nerve and supply parotid gland. So this is the secretomotor pathway to supply the parotid gland. The second is the submandibular ganglion, which is located just above the deep part of the submandibular salivary gland on the hyoglossus muscle. This ganglion is suspended by the two roots of lingual nerve, anterior root and posterior root. The preganglionic fibers arise from the superior salivatory nucleus located in the pons. These fibers pass via the chordae tympani branch of facial nerve, which will eventually join the lingual nerve, which is one of the branches of posterior division of mandibular nerve. From here, the fibers relay in the submandibular ganglion, and the postganglionic fibers pass via the branches of the ganglion and the lingual nerve to supply the submandibular and sublingual salivary glands. We can see here, this is the chordae tympani branch of the facial nerve, which is joining the lingual nerve here, and via the lingual nerve, the chordae tympani nerve, which carries the preganglionic parasympathetic fibers, which are arising in the superior salivatory nucleus. These fibers pass via the posterior root of the lingual nerve and enter the submandibular ganglion. The postganglionic fiber arising from this ganglion will supply the submandibular salivary gland. Some of the postganglionic fiber re-enter the lingual nerve via its anterior root, eventually come out in the distal part of the lingual nerve to supply the sublingual salivary gland and the anterior lingual glands. The third ganglion is the pterygopalatine or sphenopalatine ganglion, which is the largest peripheral parasympathetic ganglion. It is located in the pterygopalatine fossa, just below the maxillary nerve and suspended by the maxillary nerve via its branches. The preganglionic fibers arise from the neurons present near the superior salivatory nucleus, that is the lacrimatory nucleus. The preganglionic fiber from this nucleus pass via the greater petrosal branch of the facial nerve, This will relay in the pterygopalatine ganglion, and the postganglionic fibers which arise from the pterygopalatine ganglion pass via two different nerves. The first route is via the nasal and palatine branches of maxillary nerve, which will eventually supply the mucous glands of the nose, paranasal sinuses, palate and nasopharynx, whereas other postganglionic fibers will travel via the maxillary nerve, its zygomatic branch, its zygomaticotemporal branch, which will eventually communicate with the lacrimal nerve, and from lacrimal nerve, it will supply the lacrimal gland. So here we can see the greater petrosal nerve, which is a branch of the facial nerve. It is carrying preganglionic parasympathetic fibers arising from the lacrymatary nucleus. The greater petrosal nerve is carrying parasympathetic fiber. It is joined by another nerve, that is deep petrosal nerve, which is a sympathetic nerve. The two nerves eventually form the variant nerve, or the nerve of the pterygoid canal. This nerve of pterygoid canal will come towards the pterygopalatine ganglion, where the parasympathetic fibers carried by the greater petrosal nerve will relay in the ganglion, and the postganglionic fibers will pass via nasal and palatine branches to supply the various mucosal glands in the nose, palate and pharynx, whereas other postganglionic fiber will pass via the maxillary nerve, its zygomatic branch, the zygomaticotemporal branch, and communicating branch with the lacrimal nerve, and via the lacrimal nerve eventually supply the lacrimal gland. So in this diagram we can see here that all the glands above the level of oral fissure are innervated by greater petrosal branch of facial nerve, whereas all the glands below the level of oral fissure are innervated by chordae tympani branch of facial nerve. The last ganglion is the ciliary ganglion, which is located near the apex of orbit between the optic nerve and the lateral rectus muscle. The preganglionic fibers arise in the Edinger-Westphal nucleus, which will pass via the oculomotor nerve, and then via the nerve to inferior oblique will relay in the ciliary ganglion. The postganglionic fibers come out of the ciliary ganglion via short ciliary nerves and eventually supply two smooth muscles. One is the sphincter pupillae muscle, which will constrict the pupil for pupillary light reflex, and other is the ciliaris muscle, which will help in accommodation of the lens. So here we can see this is the oculomotor nerve carrying the preganglionic parasympathetic fibers, which will pass via the nerve to inferior oblique to the ciliary ganglion. The fiber relay here and the postganglionic fiber come out of the ciliary ganglion via short ciliary nerve to supply sphincter pupillae and the ciliaris muscle.